And it's not just those testing center workers who need protective gear. Hospital employees have reached out to us, worried there's not enough for them either. Matt Doherty is looking at the shortage and what's being done about it tonight. Matt?
Yeah, this shortage of protective gear is really frightening for so many of these hospital workers. They're being asked to care for these patients at the risk of contracting the virus themselves. The supply of protective gear for medical workers is running low across the country and here in our local hospitals.
We do know that there is a supply shortage.
Health departments are shuffling supplies held in local inventories. The city of Houston donated 10,000 masks to the Texas Medical Center.
We're also hopeful that federal and state assets get here, so we're able to actually now move forward.
We need millions of masks.
Today, President Trump announced the release of 5 million N95 masks from the Department of Defense for hospital workers. 1 million more is on order. But until they reach the hospitals, medical workers are concerned.
We have to get personal protective equipment because we're going to lose our workforce if we don't.
Save the mask for somebody who's sick or for the healthcare providers who are taking care of them.
Last month, we showed you how lines formed outside medical supply stores where people paid $25 for $4 masks. Some say the panic buying is what's led to the shortage.
I think we forget that physicians and nurses and healthcare professionals are human too. We walk to the bedside like we always do, but now we are knowing that we are not protected and we're facing our own death.
Now, officials have requested that everyone delay their elective procedures as well as any dental procedures so that those masks and protective gear can all be conserved. Mia, back to you.
Yes, let's work to keep everyone safe.
Some leading specialists from Asia, where the disease first struck, are saying this morning that face masks may have played a role in helping them contain the coronavirus outbreak. And not hospital-grade masks, just masks made of fabric. The head of the Chinese Center for Disease Control and Prevention told Science magazine that the big mistake in the U.S. and Europe, in my opinion, is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others. Jeremy Howard, a research scientist at the University of San Francisco, wrote an op-ed in the Washington Post highlighting data from COVID-19 success stories in Asian countries such as South Korea, Hong Kong, and Taiwan, where everyone is wearing masks.
So I've analyzed 38 scientific papers that have looked at the relationship between using masks and the transmission of COVID-19 and similar kinds of viruses. And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
Here in the U.S. in late February, the U.S. Surgeon General shared this on Twitter, saying, seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. The government's advice is in stark contrast to what people are practicing in countries such as Japan and South Korea. Again, these are not N95 masks that health workers desperately need. Some health experts believe one reason U.S. officials have discouraged people from buying masks is because the N95s are in short supply.
So if you go and buy up N95 respirators, that means there's going to be some doctors and some nurses who will have to make difficult decisions. You know, they might have to reuse their N95 respirator or try something else.
And thanks to Steve for that. And earlier this morning, I asked Dr. Fauci to weigh in on this debate.
Yeah, I mean, obviously the most important use for a face mask is for a healthcare worker to protect that person from getting infected. The second most important is to put it on someone who's infected to prevent them from infecting healthcare workers and those around them. But there is some rationale that the person in the street who may not know they're infected could actually prevent the spread to other people by wearing masks. This hasn't been proven. We know the masks are not 100% effective. People might think and get under the impression that if they wear a mask, they're completely protected, and they're not. But even when you pull back and think about it, we're starting to re-examine the possibility that if there are enough masks, should everyone be wearing masks? Those who are trying to protect themselves and those who are trying to protect others because they might be infected. There was always this feeling that there's not enough masks, so you got to prioritize them to the healthcare workers and to those who are infected. But given the situation that we might have enough masks for everyone, I think there's some rationale that we should utilize them much more than we do at the present time.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here, so go on.
Okay, I just wanted to give a quick demonstration of how to turn an ordinary t-shirt into a protective mask. So you put the t-shirt on, you start to put the t-shirt on just as you would the regular way. You take the sleeves and you hold them with one hand. The back of the shirt should be kind of right over your eyebrows and with the front over your nose, and then you pull back on the two sleeves like that. So now you got this kind of thing going on, and then you tie the sleeves in a knot behind your head. Tuck these in if you want to. Okay, but the main part is that the virus is carried in droplets. So you want to keep those droplets from getting to your mouth and your nose. These viruses are particles, and they're blocked by high density fibers. So in these protective masks, it's the density of the fibers that filter out the particles. This t-shirt probably has greater porosity. It probably doesn't have the same density of fibers as a surgical mask. And so you want to do is create multiple barriers. So the idea being that if you don't have one barrier with the sufficient density of fibers to filter out the particles, you can use multiple barriers. Multiple barriers, you can ultimately achieve the same effect as one high density barrier with multiple barriers that may be of perhaps less density. So I have 3 paper towels here, just layered, and what I'm going to do is just put my hand, fold them on my hand like this, and use my hand to guide it up my shirt and cover my nose with the paper towel. Okay. So now I have my nose covered with the paper towels, and what I want to do with the bottom of the shirt or the tail of the shirt, I want to pull that behind me and also tie it in a knot. Okay, and there you go. So the second part of protection is gloves. So the way you contract the virus is through droplets coming from your nose and your mouth. So once you have that covered, that's one layer of protection, and then the other is touching surfaces like doorknobs and handles and other in public places where the virus can, remain on the surfaces of these things for, they say, days. I've heard anywhere from 3 days to 9 days. But what you want to do is create a barrier between yourself and each one of these surfaces, either with gloves or just paper towel that may be doused with alcohol or some other disinfectant. I've also used hydrogen peroxide, and that will help mitigate the spread of the virus to a great extent. Also practice the social distancing, at least 6 feet away from people that you're talking to, the cashier, at the grocery store, over the checkout counter, or people that your neighbors that you're talking to. Make that, create that 6 feet of distance, because the virus has been said to only be able to travel 6 feet.
It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces.
And of course, this is only one-time use. After you use this, you want to take the paper towels out, throw them away, and then wash the t-shirt. So you probably want to have 7 t-shirts that you rotate every day, or maybe 14 t-shirts where you have one in the morning, one in the afternoon, and you just wash those 14 t-shirts every 2 weeks, you know, to just make sure that and wash them in, you know, a mild Clorox solution. You know, these are white. They are white, and so you can bleach them. And you know, the viruses, I don't know of any microbe, whether it's a virus or bacteria, that can survive a Clorox solution or alcohol solution.